Oh, yeah, it's preparing to live stream.
Okay.
All right, and you guys should all get a dialog box that says that we're live streaming on our Facebook page here. So, okay,
there it is.
yeah, it looks like it's up there.
Yep.
Hello, everyone on Facebook. My name is Michael Andriolo. I am a reporting fellow at the Land, and this is Tour the Land. Thank you guys for tuning in. And I just want to give our attendees just a few more minutes to file in. It's 7:03, so we said we were going to get started around 7:05 or so. So we'll hang on a second. Although I don't blame anyone who signed up and then opted to go outside today. I don't blame them at all. Anyone else do anything fun outdoors today?
I chased my dog. He got out underneath the fence, and so I she put the Kyrie Irving crossover move on me. But I got her.
Nice. What kind of dog?
It is what is that dog? It's a little dog. It's a little furry, cute dog. I have to ask my wife all of that information.
Yeah. Those little ones are the most nimble, though. They will squirm and twist and turn all over the place.
Yeah, my next door neighbor walked out with the dog in her arms, and if I had tried to get her, she'd fake me out. So,
fair enough. All right, so it looks like it is 7:05 now. We might have a few more people file in, but I think we're going to go ahead and get started. So first of all, I would like to say thank you to everyone who is either tuned in on Facebook or joined us here in this meeting live. My name is Michael Andriolo. I'm a reporting and now, in case you didn't know, The Land is a nonprofit news organization that reports on Cleveland's neighborhoods. Through community-powered journalism, we aim to foster accountability, inform our communities, and inspire people to take action. You can check out more at thelandcle.org, and I will drop that link in the chat. And I'm going to drop some other links in the chat in case you want to get our newsletter or become a member. So if you want to just check out there if you're interested. So Tour the Land, which is, this event is a part of, it's a series highlighting Cleveland neighborhood leaders that are making a difference in their community. Tonight, we're continuing that series with a conversation about hyper-local vaccination efforts and outreach. So as the Omicron wave has sort of subsided, so too, it seems, has a sense of urgency about the pandemic. But for the grassroots community advocates that we have on our panel today, protecting their neighborhoods from COVID has remained top of mind for a while now. Meanwhile, Cleveland's vaccination rate lags behind that of Cuyahoga County suburbs. The lowest rates in the county have been, particularly in some of Cleveland's communities of color. And that aligns with a lot of the other racial and socioeconomic disparities stemming from chronic disinvestment in Cleveland. Now, it's with that in mind that we're going to talk to our panelists today, not only about how the relationships they've built in their communities make them trusted sources of information about the vaccine and about the pandemic in general, but also how their community-rooted efforts are building bridges between Cleveland's communities of color and the governmental and healthcare systems that for decades have left them out. So before we get started, I would like to introduce our panelists. Elaine, you're the first one that I see on my screen here. Would you mind unmuting and introducing yourself?
Yes, thank you so much, Michael and the Land, for this opportunity to speak about what we're doing in the community for COVID outreach. So I'm Elaine Tsao, and I have the honor and privilege of leading the largest health and social services agency in the state of Ohio that's focused on addressing the needs of Asian Americans and Pacific Islanders, as well as immigrants and refugees from all different continents. So that includes Africa as well as the Middle East. So Asia's mission is to serve, support, and advocate for AAPIs, immigrants and refugees, so that they can prosper and flourish. I have uh, the wonderful opportunity to supervise a leadership team that is responsible for providing direct health and social services. We do policy advocacy, capacity building, community engagement, as well as special projects. So Asia's International Community Health Center is a federally qualified health center, or otherwise known as an FQHC. So we're on the ground providing COVID services.
All right, wonderful, thank you. And next on my list, I see Reverend Dr. Lisa Goods. Would you mind introducing yourself?
Thank you, Michael. My name is Reverend Dr. Lisa Maxine Goods. I am the senior pastor of Shiloh Baptist Church, located in the central neighborhood of Cleveland. Shiloh is the oldest Black Baptist church and the second oldest African-American church in the city of Cleveland. So we have a long history and legacy of working with and serving the community. And I am also a member of Greater Cleveland congregations. So Shiloh works with Greater Cleveland congregations. Greater Cleveland congregations is an ecumenical group that does social justice and community power building work within the city of Cleveland. And so we are an organization of right now 34 congregations that represents over 5,000 congregants and thousands of Clevelanders in the neighborhoods that we represent. And that also includes some social service agencies as well. And so I serve on the strategy team at GCC. I am the co-chairperson of their Battle for Democracy and a member of their Color of Health initiative, which has been doing work in testing and vaccinating our communities, particularly the underserved communities of color.
Gotcha, thank you so much. And Selena Pagan, you're up next.
Hello, everyone. Good, you can hear me, perfect. My name is Selena Pagan. I am the Executive Director of the Young Latino Network. Born and raised in Cleveland, Ohio. I'm a Puerto Rican woman working within the Latinx community. The Young Latino Network has been around for over 20 years, and so as this organization continues to evolve and grow, we've been really just focusing on engaging our community in really culturally relevant and competent ways, especially throughout this pandemic, whether it's been around democracy or COVID-19 or vaccination efforts in our community. Just collaborating with a lot of Latinx and ally partner organizations to engage and activate and mobilize our communities. So it's a pleasure to be here with all these all-stars. Thank you for having me.
Absolutely. And last but certainly not least, we've got Kevin Chilherd. So I'm going to turn it over to him to introduce himself. And then he, with much more radio experience than I have, is going to take over and lead our conversation going forward. So thank you so much, Kevin, for that. I also want to mention that the land is partnering with Mr. Herd's organization, My Cool Solutions. That's his nonprofit for this event. So take it away.
Thank you very much, Michael, and everybody is still thrilled on the story that you did that I was a part of. So everybody's still raving, and great job on that. My name is Kevin Chilherd. As he said, I'm the executive director of the nonprofit My Cool Solutions. I am also currently the president of the Greater Cleveland Association of Black Journalists, and I also host a radio show called Chill Talk. And some people also may know me as a part of the Cleveland Guardians, not the new baseball team, but the Guardians that you see out talking about vaccine information, vaccine literacy, vaccine hesitancy about this pandemic. So I've been working on this, and I am thrilled to be here with this panel, looking forward to the discussion that we will have. So I'm going to start this right off because as Michael said earlier, we've kind of become relaxed as it comes to the pandemic. And most people, as I know, I found when you're out here talking about it, people are saying, why are we still talking about this? Mandates have been kind of lifted, where people don't even have to wear masks anymore. We've kind of forgotten about social distancing. Why is it important during this pandemic that we are still out here fighting this fight? And I will go with Dr. Goods on that first. And you're on mute.
Oh, there, yes, there I am. Thank you for the question, Kevin, because it is a very relevant question. Right now, we are in a period where rates have come down. But if we recall, a few months ago, we were also in this predicament before Omicron hit. We were in this predicament before Delta hit. And so we know that there are other variants that are out there. We know there's the stealth variant that is in Japan. There is a B2 variant that has been seen here. And I was just watching how they are seeing an uptick of COVID in our water here in the United States, which is an indicator that another wave is coming. The other thing that is really, really important in underserved communities, communities of color, communities of minorities and poor people, we know that those are the most vulnerable people. They were the most vulnerable when this pandemic started, and they are also the least vaccinated population. So as we see other neighborhoods with higher vaccination rates and people lifting mandates, our people in our communities are still vulnerable. People are still getting sick. And unfortunately, with cuts to COVID funding, there may not be resources available. And again, those populations will be left behind. And so we're trying to get ahead of this curve and make people safe and vaccinate our communities.
It very well said, and I'm going to ask the same question to Elaine, and kind of elaborate on that same question, but also tell us how difficult is it to keep your community active in still getting vaccinated for those who have not gotten vaccinated or haven't gotten the boosters as things are starting to relax. How difficult is that fight to keep trying to engage your community in being vaccinated?
Yeah, there are so many different challenges that we have in reaching the community that we serve. So at Asian Services in Action, you know, we are seeing those that are limited English proficient. So there's a language barrier sometimes with regard to accessing resources, and that includes testing as well as the vaccine itself. Most of the time, there isn't sufficient interpreting and translation access for the communities that we serve. So Asia has been that connector to make sure that, you know, instructions for COVID testing have been translated into the languages of the community members that we're serving. But on top of that, many of the community members that we're serving, if they are refugees who have been you know, through some sort of ethnic cleansing process before they came to the United States, they might have been barred from getting education even in their country of origin, so they might not be able to read. So sometimes even if we translate materials, it's still not accessible to the community members that need the information because they might not be able to read. And so we have also needed to provide information through videos, to provide video demonstrations for the testing and the testing instructions so that folks who cannot read can still get the information that they need to be safe. With regard to accessing the vaccine, we have been, like many other organizations, providing incentives through various resources, both the foundation support as well as support from the Ohio Department of Medicaid. They are providing Vax on the spot, $100 incentives for those that are eligible to receive the vaccine. And when they get their primary doses, they get that financial incentive. And if they're not eligible for that program, we have obtained some private foundation support so that we can still incentivize the community members to get vaccinated. But I will tell you that I'm part of the outreach team that goes out into the community, and we have encountered individuals who have asked us in language. You know, I'm bilingual, and we'll go out with community members, and they'll say, well, if the vaccine is good for us, why are you paying us to take it? And so there's definitely a layer of I guess concern and also a layer of trust that needs to be maintained. You know, fortunately, they believe us. They believe us because we speak their language, and we are able to share with them that, you know, maybe in the past there have been systems that were not always looking out for your best interest. But we share with you today that that's not the case now. You know, we are in a public health emergency, and, you know, I myself have been vaccinated, and our outreach team members have been vaccinated, and we're telling you as fellow community members that you can trust that this vaccine is safe and effective. And so it's really important that that message is coming from us, as opposed to, you know, the CDC or the government, because a lot of times the community members that we're outreaching to, they have a fear and a mistrust of government. So it really matters that it's coming from a fellow community member.
Well, you know, and I'm glad you brought that up. And I want to ask Dr. Goods, part of what we're hearing, the success of getting the message across, is people are not trusting of the CDC, or they're speaking a language or scientific information that they're not relating to. It's not digestible. And it seems that the medical community has a messaging problem, first of all.
Mhm.
But when it comes to clergy, people listen to people that they trust. How important has it been for the clergy to get educated on this pandemic and to get involved?
Oh, it has been essential. I am a member of Greater Cleveland Congregations, as I said. We have been out on the forefront since the beginning of this pandemic, both doing testing and vaccinations. And before the government realized that they needed to use community agencies and churches specifically, we were advocating for this because we know the distrust, particularly in the African American community. When we think of things like the Tuskegee experiment, the Henrietta Lacks situation, and then just the medical apartheid and mistreatment of people by our medical systems. There are many, you can talk to people who have stories about our local health systems, and they are also distrusting of government organizations, but they do trust their clergy. We, for instance, Shiloh has been in the central neighborhood for 172 years. We've been feeding the community. We've been helping the community. So when we speak, our community does trust us. And so what we've been able to do, we've gone and looked at the data in the most vulnerable communities, and through Greater Cleveland Congregations, we were able to put together dollars for doses, where, as Elaine spoke about, we provide incentives for people to get vaccinated. But those communities were identified by the Social Vulnerability Index. They are the most vulnerable, with the lowest vaccination rates. And what we are doing is we have clinics every 2 weeks. We started in the month of February, vaccinating people. The first dose gets $100, second dose gets $50, $25 for a booster. But what we also did was there is a $25 incentive for everyone who brings a person. So not only are we relying on our own, the trust people have in us, but in their neighbors. So what we saw a couple weeks ago in Shiloh was 206 people got vaccinated in the central community, whereas local clinics are seeing 6 to 10 people in a week. We got 205, and you saw African-American men were the majority of those, and they were going out and bringing their friends in to be vaccinated. So they not only trusted us as a organization, but we were able to provide the help that people need in this pandemic, because we also realize this pandemic has raised food prices and gas prices and everything else. So the incentive is our method of caring for our community as well.
Well, and you brought up a couple things that we're going to have to come back to and definitely unpack when you talked about mistrust of the system. And one of my favorite topics, our understanding of Tuskegee. So we're going to definitely get back to some of those bullet points and unpack those. But I want to ask Selena, we're 2 years in, and I got a chance to talk to Elaine and Dr. Goods. We're 2 years into this. How is the Latinx community holding on? How is engagement? How hard is it to keep the ship afloat and getting this information out and getting people engaged 2 years in after we've been dealing with this pandemic?
Thanks, Chill. You know, it's been quite the roller coaster for all of us, and I think that we've learned a lot of lessons, right? I think that we talk a lot about this pandemic, specifically about COVID-19 and vaccination efforts and information, but looking at this proactively and how much we have learned and how much we understand now that there's way more work to do than we thought, right? And so everyone has been doing their part, right? This is taking collective efforts and a lot of trial and error to figure out how we get the right information, the correct information into communities. And, you know, one of the hardest parts of this work has been, honestly, some of the faith-based Latinx leadership that has, you know, put out messaging and misinformation through their congregation. So we've had like this really interesting dynamic in our community where we have really awesome faith-based leaders that have been hosting clinics and that have been doing their part and educating the community. And then we have other folks who have not, we've had, you know, and this is across all communities, right? So I think like there was a moment in time where we're trying to do really good work and trying to get community the right information in all kinds of ways. But then you see folks within our communities who kind of disrupt the environments to learn and to find accurate information, whether it's some business owners, whether it's faith-based leaders, whether it's our neighbors, you know. And I think that has been the hardest part, because it just shows that we as a community haven't done our part to really actually build community, right? Because we throw that word community around a lot, and there's a lot of leaders and organizations and people in general that talk about community. But how do we really define community in this sense, right? And how do we talk about this work in a way that, you know, we have built trust with folks in neighborhoods and communities all around Northeast Ohio to get the job done? And so, you know, for the Young Latino Network, health was not a space that we're in, like that we're not a health organization. We're a network-based community engagement organization, and I think that's what has kind of allowed us to do some of this work. We've been able to collaborate with a lot of the Latino organizations who have been doing this work to strategize and organize around it, because we all have our different parts of the community that we touch, right? And I think that you see this in a lot of different communities where we know that the Latina, Latinx community is not a monolith, right? They're not all Puerto Rican here in Cleveland, right? We have large Mexican populations, large Colombian, Salvadoran, Guatemalan. And so knowing how, you know, we have to get this information out to all of these different groups of people We've learned a lot. We've learned a lot of hard lessons. But, as we continue to do this work, learning that like translation services are one thing, but like translation services won't solve all of these issues, right? There's a level of competency, right? A level of trust that you need to do this work. So when our allied partners come to us and say, hey, we need this translated. Well, like, that's not our job. We're not a translation service. You guys should be allocating funding not only to translate, but to hire people who are on the receiving end of these efforts, right? Within your organizations to support these diverse communities that you're trying to reach. So there's been a lot of lessons, and I can go down a rabbit hole about it. But here we are, right, where we think we're at the finish line and we think we're back to normal, when the reality is that we need to learn how to live with what the stage that we're in now, right? So that's a little bit about some of the stuff. It's been quite a roller coaster, and it's going to be a little harder now, right? Now that everybody thinks that like this is over with. So why do we need to continue to have community health clinics and vaccination clinics? Well, we haven't learned enough from these last 2 years. We're going to see some, upticks, and we might see, every couple months is going to be different. And for me personally, a little nervous about what fall could look like, right? After a booming summer of warm weather and people coming outside and doing their thing, but come fall, what is this? What is 2022 going to look like? So, thank you.
You know what, you are absolutely right, and like what Dr. Goods was saying is when we start seeing new waves, new variants in other countries and other parts of the world, we have learned one thing for sure is that we're not on an island. What happens in other countries will definitely affect us. So that is something we all need to be knowledgeable of. But I want to ask Elaine, because you were talking about communities, and as underserved minority communities in so many ways, the Asian community has had a unique experience when it comes to this specific pandemic. Elaine, can you talk to us a little bit about the narratives of Asians having to deal with the fact, the Asian community having to deal with the fact that they are being blamed for this pandemic? How are you guys dealing with that? How have you related to your community? How's your community? What are you hearing from your community on how they're dealing with this aspect of it?
Yeah, that's been, like a second pandemic for the Asian community, to have to respond to just like the level of hostility and hatred towards an entire race based on something that is, like just completely nonsense. Unfortunately, there was, this false narrative that something about the DNA of Asians makes us somehow spreading or causing, or the source of COVID, and none of that is the truth. I, at the very beginning of the pandemic, I could not go to a grocery store or be in public, quite honestly, without like negativity directed towards me. So if I was in a grocery store and I walked down an aisle, someone who did not look like me would, do a turn on the dime and then go a different direction. And if I was in the same like an elevator space or something like that, I would get on the elevator and with somebody already on it, they'd get off. And then the coughing, like the fake coughing, where someone would cough and then say COVID under their breath, if I walked past. I mean, it was really, really difficult to navigate that level of hostility. And I know from I happen to be an attorney, but that's like not necessarily relevant to this COVID discussion, except that we had community members who came to our office to report that they had been spat on, sprayed with like Lysol, or sprayed with hand sanitizer or things like that. And as an attorney, I know that those things are assault. You cannot touch somebody else, which includes like the spitting and the spraying, all that is assault. And, unfortunately for the community members that we serve, they come from countries of origin where they tend to not want to report things that happen because they haven't ever been treated correctly when it comes to dealings with police and things like that. So there's a level of mistrust that already exists. And so, they would come and they would say like, what can we do? And really more just kind of coming to Asia, which is the acronym for Asian Services in Action. They would come to Asia and say, we just want to tell you about this because we're afraid and we're scared, but we don't want to tell the police. We don't want to file a police report because then the government will come get us. And it's this misunderstanding, I think, of misunderstanding and also like a altered relationship with police that makes the problem continue. It persists because no one is reporting it. And then, we can't force anyone, right? We can't force anyone to report incidents that are happening. But at the same time, all we can do if a client comes to us and says that they don't want to report it, all we can do is support them in their sharing of something traumatic that happened to them and move forward. But I do everything in my capacity as a lawyer and as someone who's bilingual to encourage them, please, auntie, please, great aunt, please report it because we can't do anything about it if there isn't a report and for it to be investigated and followed up on. Maybe this can be brought to justice. And so, but those are challenges, and those are part of the systemic issues that we deal with on a daily basis, where there's mistrust of police. So then we don't report. And then if we don't report, then we can't address, some of those deep-rooted issues that are impacting the community. So it's very, very difficult, but and some of the responses from the community members have been that they don't go out, which was, kind of challenging because, we're a social services organization too. In addition to being a health center, we're a social services organization. Some of the community members that we serve by providing them with food. And and in the past, pre-pandemic, they would come to some of our food distribution days. But then we had this added burden of having to deliver the food to community members because they were too afraid of assault. If they left their homes, they were afraid of getting assaulted. So then we had to set up a whole delivery system to get the food that they needed. I mean, these are like basic needs that could not be met because of issues that arose from a false narrative about the spread of the pandemic or the origins of the pandemic. And, it largely targeted and affected our elderly Asian women who are especially vulnerable. The reaction was kind of this uptick in anti-Asian hate, which, I'm sure we've heard about, where, innocent grandmothers just getting knocked down and, harm caused to them because they were being blamed for this pandemic. It really kind of broke my heart in many different ways because that could have been my mom or a grandma. So.
Kevin, would you mind if I commented on something that Elaine said? Because she brought up the systemic nature of this whole pandemic. And so there is this intersectionality of the virus and systems of oppression. And so she talked about the Asian community, but let us not forget that 1 million people have died, and the overwhelming majority of those, particularly at the beginning of this pandemic, we found were people of color, particularly Black and brown persons, because we've always had an underserved community as far as medical services. So they are the most vulnerable anyways. They have the most underlying conditions because they live in food deserts, because they live in public housing that is not maintained, because they are the lowest income people and cannot afford not only health coverage, but healthy food. And so all of these underlying issues came to bear when the pandemic came down, and we saw that where African Americans, for instance, were like 14% of the population, but were 25% of those people who were getting COVID, where we saw the Asian hate. And then this took place at the same time that we had George Floyd, Breonna Taylor, Ahmaud Arbery, and the racial uptick. And so when we talk about trust in our community, that's the other reason why churches, Greater Cleveland congregations, the Latinx, young Latinas, and the Asian services are essential and are going to be essential going forward, because we cannot forget. People will not forget. And so we have to continue this wave of using these trusted organizations.
And thank you, Dr. Good, for bringing that. Certainly. And as I heard Elaine speak, and I could see Selena reacting, it is at a time that we should be coming together as a community. We have often found heartbreaking stories like she has related this pandemic in some of us has brought out the worst. And I do want to go to Dr. Goods, but more about the systemic racism. But I want Selena to react about what she heard and her perspective from the Latinx community, because I see you were moved by that.
No, because I this isn't the first time we're having this conversation. No, these folks have been saying this stuff for a long time already throughout this pandemic, right? And so, like Dr. Good said, Reverend Good has said we were essential, and I'm like, essential, yes, but exhausted, right? Because I know that this has hit us so hard, and that we have to carry this weight on our shoulders as Black and brown people of color in Northeast Ohio, continuing to do this work. And it's really heartbreaking because we become so desensitized throughout all these things that have happened, right? And we have not been able to truly honor the lives lost, not just because of the pandemic, but all that has happened. And I think that just as people, right now we're so busy with the day-to-day, right? We're just caught up in survival mode, that we don't get to process the grief that we experienced, the trauma that we've experienced. And we just have to keep going, right? Because we don't have a choice for our communities, right? These folks have dedicated their lives and their careers to do this work. And that is a heavy weight to carry. And it's exhausting because, these conversations are amazing and we get to shed some light on these things. But every time I feel like that we shed light on these issues and these disparities and all of this, the things that we know that we have to live through every day, it just takes a little bit from us every time, right? It is exhausting. And, part of, when Elaine was speaking about, this anti-Asian hate, this sentiment, this just, it breaks my heart because, as allies to all of these different communities that we're a part of, it's just been, we all have our issues to deal with, right? And our systems that we have to break down and reconstruct so that they do what they need to do for us and our communities the way that our communities actually need it to be done, right? And this has always been talked about as equity, right? Everybody talks about equity and equitability and all of this stuff, but what does that really mean to the people within our community? And so I think that it's just been a really hard time, I think, for a lot of folks who have to put on awesome like smile and have to get to work and lead these organizations who are doing the work when these funders and these folks who don't have to do this grunt work, who don't have to be on the ground, get to write the checks, right? And then tell us how to spend it. And so there's a lot of, I'm feeding off this energy. I really appreciate the amazing work that everybody has been doing, but it is exhausting, and we have to say that, right? Because people don't understand that we come on these conversations and on these calls and panels, but it takes a little bit of us, and we're doing the righteous work, right? And collectively doing our part. But it is not an easy task to do what we're doing as we're coming, especially into this phase of this pandemic that we're in right now.
Yeah, as we say in my community, you're preaching to the choir. So I want to talk to Dr. Goods. We know for a fact that a lot of what we have to deal with in the African American and the Black community is a deep cultural distrust for the medical community, for the political community, and when politics combine with medicine and healthcare, we really, really do not trust the system, which also often causes us to make unhealthy decisions about our health care. Could you, I fight that fight every day. So, but can you tell us a little bit about how you deal with our people in our community who simply do not trust the medical system when it comes to treating them or believing them? Talk to me a little bit about that.
Yeah. And so I'm real honest. First of all, I started this pandemic as a chaplain in a level 1 trauma center in Delaware, and then moved to Cleveland in the middle of this pandemic. I was the first COVID chaplain. I was holding people's hands that were dying. I was there calling family members when people were dying alone. And so when I talk to people, I first of all relate that experience. And I relate how I saw the majority of those people were Black and brown people. And so the reality of this disease, but I talked to them about, so as a Black pastor, I am not going to promote something that is going to kill my community. And also talk about the fact that this technology for this vaccine was in development a long time before COVID-19 even came about, and it was developed by an African-American sister. So putting a face and some culture to what they are receiving is helpful. And the fact that you and I had a conversation, Kevin, about how we are actually, as you put it, Tuskegeeing ourselves now. So what has happened, it's almost like reverse psychology. So if you think that there is a conspiracy, what the conspiracy is that other communities and the majority population have gotten vaccinated. That's why they're comfortable opening up. That's why they're comfortable sending people back to work and back to school. But our community has low vaccination rates. And so again, we will be the people who continue to get sick, and there will not be shutdowns for us. There will not be things available. And they will say, which they are saying right now, well, you had the opportunity to get it. We've done all that we can do. We're hearing that now. People have said, well, we've done all that we can do to get these people vaccinated. And because they didn't get vaccinated, we've basically Tuskegeed ourselves by not accepting the vaccine.
Yeah, and thank you, because I have now, but I would say famous, but in most cases I've become infamous for coining that phrase that we are Tuskegeeing ourselves. And I try to tell our people out here who use that as an excuse not to get the vaccine that they got the wrong message from Tuskegee. That's an opportunity. That's a lesson to be learned on why we should be getting health care. What those brothers needed in Tuskegee was actually a shot. They needed to get an injection to keep them to treat their syphilis. Don't get me started on that one, Dr. Goods. But I hear the struggle in everybody's voice and the pain. And as you said, it's a fight. But I know for a fact that all of us have seen successes. That as we fight this fight, yeah, it seemed like an uphill battle. It is an uphill battle, but we have, through our work, through organizations that we work with, through other organizations like ones that we represent, we've had successes, probably saved unknown numbers of lives and people from having serious illness. Could somebody talk about the successes, because I don't want us to seem like we just beat down every day. Talk about the successes that we've had, because I know for a fact we all have had them, and and this is why we do what we do. Elaine, talk to me about how what you have been doing and the information has helped your work in the Asian community.
Yeah, so definitely want to uplift the work that we're doing and not just focus on the challenges, right? So we through our engagement with the community, we have vaccinated thousands of individuals. We've given them primary doses, boosters, and the ways that we have come to reach that many community members is because and the approach is different in every community, right? But for the Asian community, for the international community, there is this sense of, I don't know if I can call it like familial obligation or like moral obligation, for lack of a better word. Like if you go around and you see the guardians that we have from the Asian community, you'll see that they are our elders, right? Our elders in the Asian community. And so our messaging has really been around, what would don't you want to get vaccinated for your grandma? Don't you want to get vaccinated so you can see your grandma and things like that, because that is really something that we prioritize, right? Our elders are everything to us in our community. They're extremely revered and like our mentors and who we look up to. And so that's been our messaging. And it has allowed us to vaccinate thousands of individuals. But now we are turning the corner. And now that the vaccines are available for kids that are aged 5 through 12, or sorry, for 5 through 11, we're also administering pediatric vaccines at our International Community Health Center. And that messaging is a little bit different, because the community members that we serve, they are not familiar, or it's something new for them. Preventive medicine is something new for them, because in their countries of origin, they typically only went to the doctor if something was terribly wrong, they were already sick. And so sometimes we'll face parents who we ask or we invite them, maybe, you're getting vaccinated. How about vaccinating your kids too? Because the vaccine is available for kids 5 to 11. And the response that they typically give us in language is, why does my child need to get vaccinated? They're not sick. And then the response from us is, well, you're not sick either, but you got vaccinated. And some of them would respond that, well, I did get sick before. I had, either I had COVID or someone that I knew got COVID, and I don't want to get COVID. So they got vaccinated as an adult. And we always have to message, well, don't you want the same safety and the same protection for your kids? Your kids are important too. And so now we've started this campaign around making the vaccine something that's not scary, and it's friendly. It allows us to engage parents and their children into something that is friendly about getting vaccinated. So we have this these characters that are they're not of a particular race or necessarily a particular gender. We have these animals and vegetables that are like I said, kind of not nondescript in terms of gender and race, but it provides for a way that they can be, everyone feels included, and it allows us to start those conversations with parents about getting their kids vaccinated. And so we started it with a coloring contest, just to kind of softly introduce them to the characters. And then, and now we're incentivizing the kids to get vaccinated. And then we also just have the posters all around town, so that the characters can be seen and heard in the community, and that message can be conveyed, that it's safe and it's not scary. And so it has gotten a lot of attention in the community, and it has encouraged parents to get their kids vaccinated. So we're super excited about that.
Yes, and thank you. Selena, tell us a little bit about the successes that you've had in your community, because certainly when we hear different things that work in other communities, there are things that we all can use in ours, and we so much need to hear success stories. Tell us about those things in your community and how they were achieved from your vantage point.
Yes, thank you. And I truly do believe that, like, when we are able to come together and kind of share these experiences, that you can extract pieces of it and make it work within your own community. And so one of the things that we saw in 2020, actually, it was actually started because of the 2020 elections, and the primary election specifically, when there were date changes moved, and there was no way of getting information to the community about this primary election being changed. We're like, we need to really try to get creative about how we're going to reach our community in a pandemic where we don't gather. Like, it was a lot easier to pass out flyers and talk to community at festivals and events, but now everybody's in their houses. So what do we do? And so one of the really coolest things that we were able to really do in 2020 was start the caravanas. And the caravanas are caravans around the community, a line of vehicles with a loud PSA speaker. And we would just go out in the community, and we started by just giving out election information. And then we realized people don't have time to worry about elections when our folks are dying. We need to implement some PPE supplies and give out COVID information, COVID testing sites at the time. Because again, this is all connected. When we think about this pandemic and the work that we're doing, we have to think about it holistically. It can't just be one thing, right? And so when we're talking about the work we do in democracy and the impacts within our community, we need to be talking about all of the social determinants of health and the health of our communities. And a healthy democracy. And so the caravans were a really cool experience for us, and it was a lot of fun. But that is kind of what kicked us off into this whole COVID-19 outreach space. And so after doing the caravanas throughout the neighborhoods on the near west side and helping other neighborhoods throw caravans for all kinds of events, I was able to support a Juneteenth and Buckeye Shaker with a caravan with Jeepers Creepers. It was really cool the way we could take these caravans and put it in different neighborhoods and customize it so that it would work and it would actually reflect the communities in which they were in. And so it was a lot of fun. That was one of the first things. And at that time, the Young Latino Network didn't have any staff. We didn't get our first executive director, me, until August of 2021. But we still continue to do this PPE supply giveaways and caravans throughout the year. And then when we had an opportunity to host community health clinics and a Hispanic Heritage Community Health Fair, we realized, wow, there is a need to create spaces in our community that are trusted, right? And so creating spaces and places of trust is important. And so one of the things that we realized was we have this amazing building that we're in the Clark Fulton neighborhood. We haven't activated it. So how do we create this as a space where the community knows that they can come and get resources? There's going to be a clinic, a community health clinic. We don't call them vaccine clinics. Just because we want all kinds of health resources, whether it's, democracy work, whether it's workforce and workplace resources. So College Now is there. We have these like all kinds of people tabling our events, but we also have a vaccine clinic and people can get flu shots. So we've created this space of trust where the community knows that the third Saturday of every month they can come to these clinics and get resources, all kinds of resources, and get a vaccine, get a booster, right? Get their first, second shot, a booster, a flu shot, and then a bunch of other stuff. So I think we've learned a lot of lessons throughout this time, and it's been really exciting work. We're excited for it to get warm outside so we can get really creative on what we can do in our public spaces right now that we're in this time. So a lot of positive stuff. We just hired a full-time program coordinator that's supporting our COVID-19 efforts. So this little mighty one team, one member organization is slowly growing. And we get to do more work intentionally in our communities. But one of the other biggest successes that I think we continue to work on every day is just the collaborative nature of our organization and our leadership. Like, we know that we can't do this alone. Like, this has to be a collective effort. Like, we need to set our egos aside and really get to work, roll our sleeves up and join our brothers and sisters in all these different communities and really put in that work. And so I think one of the coolest things was setting the tone for collaboration and just transparency around other nonprofit partners and other partners, healthcare partners, to be able to do this work. And so a lot of good lessons learned, a lot of awesome successes, and like Elaine's successes, Reverend Good's successes are my successes as well. Like, I'm cheering them on over here where I'm at, and like this is all of that work happens as a collective effort to like do greater good in our community. So I'm excited. We are all doing amazing things, and I'm just really glad to be here.
As you said, Selena, keep giving them that work. And Elaine brought up the fact of the people from the Guardians, where that campaign is working in her community. And certainly as a member of that, I have to give a salute. And I'm doing shout outs today. Give a shout out to the Guardians of all the work that they have done, and I am proud to be a part of that. I once said at a meeting, and Michael reminded me that I said when we all get together, when the Guardians all get together, I feel like we're the Avengers. And I said that if we were the Avengers, I was Tony Stark, because he was kind of cool, right? But then they said, well, my friend told me, well, you know, Tony Stark didn't make it to the end, Chill. So, okay, I'm changing it. I'm the brother, I'm the black guy that can fly. I'm the Falcon. But I wanted to ask Dr. Goods, and certainly we led off with successes with you talking about the dollars for doses. For one, I wish I could have got a couple of those hot 25s, but I missed out on that. But we don't understand how many, like I said before, how many lives and families were helped through that process. And we got a chance to lead off with you talking about that. And I see people even in the chat saying, you know, that praising you guys for that effort. But I want to talk to you about something else that's happening in our community. We get information, misinformation, alternative information from a lot of other sources. We will not listen. And you brought up the sister, Dr. Kizmikia Corbett. I want to call her by name for people to go check into her. But we will listen to people on TikTok and memes and people out here talking about you can go outside and get superpowers, or you magnets can stick on your neck, or those messages are powerful in our community. How do you deal with the misinformation that we often get when it comes to the people that you work with? Because those messages, and we joke, we laugh, but those messages are powerful in our community. They said my friend, brother Anka Keck is famous for saying a disorganized truth is something about a unorganized lie and a disorganized truth. The lie beats the unorganized truth every time. But
That's an African proverb and it's this whole story about the naked truth and a dressed up lie, and that people will believe a dressed up lie before the naked truth. Yeah, and so that is the truth. Part of what is going on is because of the distrust of much of our community, particularly our millennials, our Gen Z folks, do not trust mainstream media. Because of the way that has been utilized and politicized. And so they are getting their information, like you said, from Facebook, from Instagram, from TikTok. But we have also seen how those media sources have been used to promote information that is false. And so a lot of the information that they're getting is false. Again, as trusted leaders in our community, one of the doctors from the centers that we deal with was saying is that people in the faith community were saying that it's against God, that it is the mark of the beast, that people are putting chips in your body. And so what we have done is we're going out into the community, talking to people. As a pastor, I was out in the streets, in the projects, talking to people about getting vaccinated. And one of the things people said, you're the pastor and you're out here talking to us. And so that I was able to build trust and authority. But our program, Dollars for Doses, like I talked about, we gave $25. We give $25 for every referral. So we've had people say, well, I got vaccinated and I didn't get anything. I said, well, you bring 4 people and you get $100 too. And so brothers came in. What we saw were people the 20 somethings coming to get vaccinated. We saw African-American men coming because the incentive brought them in. And we know these are the same folks who are going to the blood bank to sell their plasma to get $100, to get $50 to try to pay their rent. And so when they came and they trusted me as a pastor, they trusted Shiloh as an institution, they trusted Greater Cleveland congregations, and then their friends went out in the street and brought them in and got $25 more for bringing them in. We created this whole chain that was able to overcome some of the myths that they were hearing. And so that's one of the ways that the other ways that Dollars for Doses has been successful. And I want to say that this program was started by 5 African-American congregations who came together last summer when vaccinations in our community had really come to a halt. And we put in our own money and came up with money. We tested it at Shiloh at one of our community events and paid people $50 at that point to get vaccinated. They came in droves. And so we were able to scale that. And now we're looking to scale it even higher because we realized we're able to have those conversations. We also had advocates who were talking to people who came in the door, but we're still kind of hesitant, and we're able to have those conversations. And so what happened was we excelled even our wildest imaginations. We thought we might get 25, maybe 50 people. Our first clinic, we got 177, and we got families. We got mother, fathers, and children. The clinic at Shiloh, we exceeded again. We had 206 people get vaccinated. And like I said, men, the 20-something, kids. And so now we exceeded our budget and our grants, and we are looking for other funders and have been in conversation even with the mayor and talking about how can we scale this? What can we do? We're looking for other community partners because we need to keep this going in all of our communities, and we want to be able to expand it to the West Side, to our Asian communities.
Yeah, and I do want to, because I don't want Brother Ankh saying I messed up his saying. He's also known as Bobby the Banger from Baltimore. And his saying is, a well-organized lie will defeat a disorganized truth every time. So I wanted to get that out before Bobby the Banger from Baltimore said, chill, why'd you mess up my saying? But I want to go to Elaine because she brought something up about one of the most effective parts of our Guardian program in her community is the use of elders speaking. And I know as a part of the Guardians, like Miss Marilyn is a star. She is somebody who you send her out and she will talk anybody into anything because she just exudes trustworthiness. But how have you guys utilized getting the message out with some of your elders who, by the way, are the most likely to be affected in a bad way by this pandemic? How are you using your elders in the Asian community to get that information and that message out in a way that people would trust?
Yeah, so as I alluded to earlier, how some community members, they can't read, even in their own country of origin language, because they were not allowed to have education in their country, but they can understand spoken word. And so we've created some videos, and one of the guardians, the grandpa guardian in the Asian community, he recorded a video that has been shared very broadly across a social media platform known as WeChat, which is a very popular communication platform in the Asian community. So such that even folks that like they might not have internet in their home, but if they have a phone that that can do the WeChat, they would have access to that information. And so the grandpa in the Guardians campaign, he did a video which was really hilarious. And I can't do it justice. I can't do it justice because obviously I'm not him, but I can translate for you like what he said in the video. So I interviewed him. I interviewed him on video, like in language, and I asked him so grandpa, did you get vaccinated? And he said yeah. And then I said, well, like what happened when you got vaccinated? Did you have side effects? Did it hurt? Did you feel anything different after you got vaccinated? And he said no. I mean, my arm hurt, but that was about it. And then the third question that I asked him in language was, would you tell your friends to get vaccinated? And then he made a funny in language, but we recorded it. We shared it out because it was funny. And in language, he said, that depends, which friends? And we were all just kind of like laughing in that moment, and we captured it kind of spontaneously, and but we captured it on video, and then we shared it on that WeChat social media platform, and it got a lot of views. Lots of people saw that little video, and honestly, some of the advocacy that we're doing around getting folks vaccinated is like a more serious message, where COVID can kill you, please get vaccinated, let's not let any more people die from this.
Certainly.
But on the flip side of that, we also have to be thinking about, we're all human beings. We don't want to necessarily hear like the darkness of COVID. We want to say, how can we get some light? There's a light at the end of this pandemic, situation. And some of that light can be like laughter again, laughter without a mask on, where kids can play together without, excessively hand washing, or, people grabbing their kids to be physically distanced. We can get to that space if folks trust that that we are looking out for their best interest and encouraging them to get vaccinated.
Well, you know what? Thank you, and you guys, we're all passionate, and we could talk about this for another 2 hours. Unfortunately, our time is come to a close. I want to thank you guys for the work, for the conversation. Let's keep the conversation going. I'm gonna shoot it over to Michael for what he needs to us to know now and how do we close this down, but keep the conversation going.
Yeah, absolutely. I mean, you guys, I can't thank you all enough for sharing all of this with us, for being so open with everyone about, all of this. I seriously, really, really do appreciate you all taking the time. I know all of you are super, super busy. And so just to get you all in one space at the same time is, I think, an accomplishment. And I really appreciate you all. But yeah, with that being said, we are just a little bit over time, so we're going to wrap it up. I apologize we didn't get to do a Q&A segment here in this one. I know that we did have some Q&As, but I'm going to drop my email here in the chat right there. And if you have any questions or any feedback that you would like to send to me, feel free to email me there. I'm also going to send out a follow-up email to this with some links to all the organizations, some graphics. I know that particularly Greater Cleveland Congregations has some upcoming Dollars for Doses events. So I definitely want to get the word out about that. So I'll include all of that information in a follow-up email to everyone that was here today. So once again, thank you all so much for coming. We're going to close it out, and just a huge thank you to our panelists once again.
Thank you. And hi, Kate. I see you out there.
All right. I'll see you guys.
All right.
Thank you.
Thank you.
All
Any of
right,
you guys
thank
need my
you.
services, just let me know. I'm there for you.
Okay, thanks.
Goodbye.